Welcome to Day 13 of the CPC Exam Prep Series by KS Medical Coding Academy. Today, we'll be covering the respiratory system, based on the latest 2025 CPT guidelines. Respiratory System Overview. The respiratory system captain codes range from 30,000 to 32,999. This section includes procedures involving the nose, sinuses, larynx, trachea, bronchi, lungs, and pleura. Common procedures include endoscopy, biopsy, excision, foreign body removal, and thoracentesis. We'll focus on high-yield areas like nasal procedures, bronchoscopy, thoracotomy, and thoracentesis. Nasal and sinus procedures. Codes from 30,100 to 31,299 cover nasal and sinus procedures. Some common codes include 30,140 for submucous resection of turbinates, 30,520 for septoplasty, and 31,231 for nasal endoscopy, diagnostic. Remember to distinguish between diagnostic and surgical endoscopies during the exam. Larynx and trachea procedures. Laryngeal procedure codes range from 31,300 to 31,599. Important ones to remember: 31,500 for emergency endotracheal intubation, 31,575 for flexible laryngoscopy, diagnostic. Tracheal procedures include 31,600 for planned tracheostomy, 31,603 for emergency tracheostomy. Bronchoscopy codes. Bronchoscopy procedures fall in the 31,622 to 31,651 range. Examples include 31,622 for diagnostic bronchoscopy with washings or brushings, 31,625 for bronchoscopy with biopsy, 31,628 for transbronchial lung biopsy. Watch for add-on codes if imaging, brushing, or ultrasound guidance is used. Thoracentesis and thoracotomy. These codes fall between 32,400 and 32,999. For thoracentesis, 32,554 is used when performed without imaging guidance. 32,555 is for procedures with imaging guidance. For thoracotomy, 32,100 for diagnostic thoracotomy, 32,160 when it involves removal of a lung lesion or foreign body. CPT navigation tips. In your captain book, locate the 30,000 to 32,999 range for respiratory system codes. Use colored tabs or highlights for nasal, bronchial, and thoracic sections. Understand the difference between diagnostic, surgical, and therapeutic procedures. Watch for add-on codes and whether the procedure includes imaging guidance. CPC exam scenario example. Let's look at a practice scenario. A patient undergoes diagnostic bronchoscopy with biopsy of the right lower lobe. No fluoroscopy is used. The correct code is 31,625. Why? Because it includes the biopsy during bronchoscopy without any imaging guidance. Practice quiz. Let's test your knowledge with a few questions. What is the code for a diagnostic nasal endoscopy? 31,231. Emergency tracheostomy? 31,603. Thoracentesis with ultrasound guidance? 32,555. Bronchoscopy with washings only? 31,622. Flexible diagnostic laryngoscopy? 31,575. Summary and what's next? Today we covered captain codes from 30,000 to 32,999, focused on high-yield respiratory procedures. You learned how to navigate nasal, tracheal, and bronchial codes, with examples and exam-style questions. Next up on Day 14, we'll dive into the cardiovascular system, including pacemaker insertions, cardiac catheterizations, and CABG procedures. Welcome to Day 14 of our CPC Exam 2025 Prep Series, brought to you by KS Medical Coding Academy. In this video, we'll dive into Part 1 of the cardiovascular system, covering captain codes from 33,016 to 33,999. Overview of cardiovascular system. The cardiovascular system includes the heart, arteries, and veins. This section of the Captain Manual is dense but highly testable. In Part 1, we'll focus on procedures involving the heart itself, such as pericardial drainage, tumor excision, pacemaker and ICD insertion, and assist devices. Pericardium procedures. Captain Codes 33016 through 33020 cover procedures on the pericardium, which is the sac surrounding the heart. Code 33016 is used for pericardiocentesis, a needle drainage of fluid. The higher codes in this series involve open or surgical drainage or creation of a pericardial window. Heart procedures, tumor excision. Next, we have codes 33140 and 33141, which describe the excision of tumors from the atrium and ventricle of the heart. These are complex open heart procedures often performed to remove myxomas or other masses. Cardiac assist procedures. Captain Codes 33975 through 33983 cover the insertion, management, and removal of mechanical cardiac assist devices. For example, Code 33975 is used for the insertion of a ventricular assist device by sternotomy. These codes are especially important when coding for ECMO or VOD procedures. Pacemakers and ICDs. One of the most frequently tested areas involves pacemakers and implantable cardioverter defibrillators, or ICDs. CPT codes 33202 to 33249 describe insertion, replacement, and revision of these devices. For example, 33206 is used for a single-chamber pacemaker insertion, while 33208 is used for a dual-chamber system. ICD insertion is reported with 33249. Tips for book navigation. When studying this section, highlight or tab the code ranges for quick access. Remember, pericardium, 33016 to 33020. Tumor excision, 33140 to 33141. Pacemakers, 33202 to 33249. Assist devices, 33975 to 33983. Use your Captain Book's bold headings and indented descriptions to avoid confusion. Common exam questions. Be prepared to distinguish between insertion and replacement of pacemakers and ICDs. Also know whether the approach is percutaneous or open. Look out for key terms in exam questions like generator, lead, revision, and removal. Device removal tips. Pacemaker and ICD removals are often coded separately from insertions. For instance, use code 33233 for removal of a pacemaker generator, and a separate code for insertion, such as 33208. Always check if both removal and insertion occurred in the same session. Quick review. Let's recap. Pericardiocentesis, 33016. Cardiac tumor excision, 33140. Pacemakers and ICDs, 33202 to 33249. Cardiac assist devices, 33975 to 33983. Understanding the device type, procedure method, and surgical approach is key to correct coding. Quiz time. Let's test your understanding with 5 quick CPC-style questions. Pause the video if needed and try to answer each one before we review the answers. Coming up in Day 15, we'll continue with Cardiovascular System, Part 2. This includes vascular procedures like bypasses, shunts, and repairs, covering Captain Codes 34001 through 37799. Don't forget to subscribe and follow along for full CPC exam prep.